Wedding prep may never be the same. In the new e-reality show Bridalplasty, brides-to-be compete against each other in various challenges trying to win the big prize, plastic surgeries, and the ultimate all-expense-paid wedding.
I am a good competitor. I'm probably one of the most intelligent girls in the house. Like, let's face it.
Congratulations! We have injectables, skincare, and we have some fillers.
Joining us now are Bridalplasty host Shanna Moakler and the show's plastic surgeon, Dr. Terry Dubrow. Good to have both of you with us this morning.
I get that excited when I have my Botox too.
You two, it was funny because watching you two watch that clip of the show, you're laughing and you're smiling, and it's, you know, you're obviously reliving some fun moments. But there's a lot of controversy surrounding this show. In fact, let's see, the Boston Herald wrote, "It just might be the most depressing TV series ever to air on television." The LA Times said it preys on the insecurities of brides. Are you at all concerned as a surgeon that this could be sending the wrong message to women?
Yeah, I've heard that criticism, but we're really not sending a message. We're really just turning the camera on what's happening across the board in the United States.
So there's no message at all?
Well, people are having plastic surgery before big events like getting married. I mean, who doesn't want to look their best when they get married, right? This is a very common thing for a board-certified plastic surgeon to do, to do plastic surgery on people before they get married.
So you are seeing more of it? Have there been, you know, sort of numbers put with it, or is it not that big yet?
It's very common, and it's been common for over a decade.
What's the most common thing women have done before the big day?
Breast augmentation, Botox, a rhinoplasty. They'll take a bump off the nose. They'll pin their ears back. Those things that really have always bothered you. You want to look your best on your wedding day, and that's the best time to do it for a lot of people.
I also think, too, when it comes to, like, reality television, the biggest thing is that I always get thrown back by is it's reality TV. You know, this is supposed to be fun. It's supposed to be entertaining. We're not supposed to be getting, like, a scope on society from the reality television that we're watching.
But a lot of people do watch it legitimately, and a lot of women look to this, and weddings have become such a huge business. They're such a focus of a number of reality shows. A lot of women work out before the big day. They might grow their hair out.
That's true.
Right.
Those things are a little bit different. So, Sheena, these women have wish lists of actual procedures they want done. Was there anything that surprised you? Because these are really attractive women.
Well, some of them, you know, were there for the wedding. They didn't really want the plastic surgery. Well, some of them were really there for the plastic surgery, and they really have relatable stories. Some of them have lost their breast to breast cancer, so they want to get implants for reasons like that. Some have done the diet and exercising, like Alexandra from The Biggest Loser, where, you know, there's certain things that diet and exercise, whether it's your genes or I've had 3 C-sections, you know, the loose skin from loss of such weight loss, you can't do anything but have plastic surgery to fix kind of those personal things.
And let's be honest, plastic surgery isn't reserved for unattractive people. It's for anybody who has something that's sort of bothering them, just as long as they have realistic goals and expectations.
Were you surprised by anything on these wish lists, Doctor?
No, because we came up with those wish lists before they were on the show.
Okay.
So we determined suitability for the procedures, it discussed the risks, the complications. These were sort of standard procedures.
The risks are, and the psychological risk could be there too, Sheena, because when you talk with a lot of these women, girl to girl, were you concerned at all with any of them about what happens after the show? They win big and then they got to go back to regular life.
Yeah, I mean, that's always you know, whenever anyone does a reality show, that's a big concern. But one of the things about this show is it's not the Swan. It's not like we were trying to Heidi Montag these girls. They really went in, and the doctor was so careful with them about saying, okay, what are the realistic, you know, having realistic ideas of what they really wanted.
It is fascinating, I have to say.
Yeah.
Having seen the first episode, so great to have both of you with us this morning.
And it's on at 9 o'clock on Sunday.
Yes, on E!
You stole my next line. So you do fine promotion work. Thank you both.